Want to know what I believe to be the cause of my lung condition in 2015? Well, this next book is a must-read for those of you whose doctors have told you they don't know the cause of your problem, no matter what it is. And it's called The Toxic Tooth by Dr. Robert Kulacz and Dr. Thomas Levy. When the New York State Office of Professional Discipline began investigating my dental practice in 2005, I realized that there were many dentists who disagreed with me. I had once been where they were, totally unaware of the comprehensive and compelling research that exposes the systemic risks of root canal treatments. With naive confidence, I thought surely these investigators were guided by a sincere concern for the public in general, and my patients specifically. Once all the science, the microbiological cultures, the pathology reports, the x-rays, the nearly miraculous patient outcomes were clearly set before them, their eyes, previously blinded by ignorance, would be opened. Ultimately, they would vindicate me and embrace my practice of dentistry. Boy, was I wrong. My journey began when a patient told me that his doctor had warned him against root canal therapy, and that this procedure could initiate a wide range of medical diseases. I quickly retorted, "That's ridiculous. Whoever said that is completely crazy. You shouldn't listen to such nonsense." I felt personally attacked, so I began to research the validity of these claims. What a blow to my professional pride. I didn't like what I discovered, but I couldn't deny the powerful evidence. My patient was right, and I was wrong. Agencies and associations that protect the dental industry will throw unmitigated and unrelenting force against any suggestion that root canal treatment can cause or contribute to systemic disease. Hundreds of billions of dollars are at stake. If the truth about root canal treatment reaches the masses, the insurance industry could be hit with a financial tsunami. Recent scientific evidence shows that the infection and toxins that remain in virtually all root canal treated teeth are intimately linked with the following. And now he lists 29 different conditions. I'm going to only list a few here, but one of them specifically states pneumonia and other lung infections, and I had a type of pneumonia. Alzheimer's, asthma, cancer of the lung, kidney, pancreas, and blood, COPD, diabetes, epilepsy, high blood pressure, inflammatory bowel disease, obesity, osteoporosis, rheumatoid arthritis, and psoriasis, to name a few. And this is why it happens. When even a tiny population of bacteria or fungi survives in a canal, they can multiply into a large colony, especially since these microorganisms are left in a dark, warm, moist space, disconnected from the body's immune and infection warning systems, so they can be free to grow without immune system challenge or detection. The infection in the root canal treated tooth can always be expected to leak. This leakage allows the bacteria and their toxins access to the bloodstream, with subsequent dissemination to the rest of the body. There is also the issue of cavitations, which is the gap left behind after an extraction, causing the same condition as bacterial leakage. This was pointed out to me through Hallelujah Acres when Ann Malcolmus did a blog entry that said her breast lump that she had completely disappeared after she had her cavitations cleared by a pioneer in cavitations, a dentist in Tennessee. So naturally, I went to see this dentist in Tennessee and had my cavitations cleared, and was very surprised. I'd had no problems with these teeth, but he said the next stage of one of them was gangrene. And now my lung condition has completely corrected, of course, supported by the Hallelujah Diet Recovery Plan that I followed to restore my health. So feel free to contact me if you'd like me to explain the situation any further with you, and perhaps guide you to do the same. So this week we have an awesome snack that sort of is one step further from the coconut nut crumble that we did last week. Just soften a date and blend it up with some walnuts. All right, just walnuts and dates. And we will get a nice mixture that will be very easy to roll into balls, and then roll that into coconut. And you get a beautiful date nut ball. Enjoy.